Good afternoon. Thank you, Dean Delaney, and greetings to faculty, staff, family, friends, and most importantly to today's 124 graduates of the Bachelor of Nursing Science program, 83 graduates of the Doctor of Nursing Practice program, 4 postgraduate certificate graduates, and 5 graduates of the PhD program. Congratulations. This moment is a celebration of both continuity and change. This year marks, as you've heard, the 110th anniversary of our nation's oldest continuously operated university-based School of Nursing, an extraordinary achievement of continuity. But it's also a moment of change, a threshold moment for each one of you. And not only is it a moment of personal change, but it coincides with the fastest period of change in the history of your school. Indeed, the fastest moment of change in the history of humanity. Dean Delaney asked me to speak with you about the rapidly emerging field of planetary health. Planetary health is the study of how humanity's accelerating disruption and degradation of our planet's natural systems is causing an urgent global health crisis around the world. It has, I have to admit, some fairly apocalyptic undertones. Now, like any well-educated person asked to undertake a momentous task, I immediately Googled how to give a commencement address. The main takeaway was be light and funny. So this may be one of the worst commencement addresses ever given. But I want to start by asking, what is the meaning of this particular moment? What is, in Martin Luther King's words, the fierce urgency of now? In fact, this isn't an easy moment for us to wrap our heads around. Viewed through one lens, things have never been better for all humanity. Steven Pinker, a professor at Harvard, is well known for promoting his very credible thesis that there's never been a better time to be a human being. Some of you will know his books, The Better Angels of Our Nature, Enlightenment Now, among others. Pinker points to global trends in human development and celebrates extraordinary improvements that have occurred over just the past 60 years. Between 1950 and 2014, the number of adults around the world who could read and write climbed from 36% to 85%. In 1950, there were 1.8 billion people living in extreme poverty and only 708 million people not in extreme poverty. By 2015, there were 705 million people living in extreme poverty and 6.6 billion people not in extreme poverty. In other words, in 65 years, we went from 72% of the world's population living in extreme poverty to 10%, despite nearly tripling the global population. In 1950, global life expectancy was 47 years old. 55 years later, it was 69. And during that same period, child mortality dropped from 214 child deaths per 1,000 to 59. So these are truly stunning achievements across the globe over such a short period, and they support Pinker's assertion that there's never been a better time to be a human being. But there's a darker side to the moment that we're in. Exactly 2 months ago, on March 17th, a male Cuvier's beaked whale washed up in the Philippines dead. It was still immature, and wondering what could have killed such a magnificent creature with a normal lifespan of 60 years, scientists performed a necropsy. Inside the whale's stomach and intestines, they found 88 pounds of plastic garbage. The New York Times informs us that we now dump 10 million metric tons of plastic into the oceans each year. The same extraordinary scientific and technological developments that have pulled humanity out of poverty, increased our life expectancies, and driven unprecedented gains in human development in less than one person's lifetime are also fueling an almost unimaginable ballooning of humanity's ecological footprint. Will Steffen and his colleagues have described the moment that we're in as the Great Acceleration. Since 1950, our appetite for natural resources and our consequent impacts on our planet's natural systems have been growing almost exponentially. In order to feed ourselves, we've converted 40% of Earth's land surface for croplands and pasture. We appropriate about half the accessible fresh water on the planet, mostly to irrigate our crops. We fish 90% of monitored fisheries at, or well beyond, maximum sustainable yields. In the process, we've cut down about half the temperate and tropical forests in the world and dammed over 60% of the world's rivers. Our wastes spill into the air, water, and soil, and the global pollution crisis is now responsible for the deaths of 9 million people each year. Human beings are crowding out the rest of life on our planet. Last week, 145 authors from 50 countries released the Global Assessment of the Intergovernmental Panel on Biodiversity and Ecosystem Services. After reviewing 15,000 articles over 3 years, they concluded that roughly 1 million species now face extinction, many within decades. Already we've reduced the population sizes of mammals, birds, reptiles, amphibians, and fishes by more than 50% since 1970. So this is the darker side of the moment that we're in. The extraordinary gains that Pinker celebrates are carried forth on the groaning back of a crumbling biosphere. But how does all of this relate to each one of you? It relates because the ecological crisis that I'm describing is precipitating a human health crisis. By the end of this century, the majority of the global burden of disability and death will be caused by the steady erosion of our planet's natural systems. This is what the emerging field of planetary health is teaching us. In my own research, I've shown that rising concentrations of carbon dioxide in the atmosphere are making our food less nutritious and threatening hundreds of millions of people with nutrient deficiencies. We found that declines in bees and other insect pollinators may cause over 1 million excess deaths each year because of lower yields of foods that are important in preventing heart disease, stroke, certain cancers, and diabetes. We're exploring how ocean warming and acidification will alter the distribution and size of fisheries around the world, and how those changes will impact consumption of fish and ultimately brain development, growth, vision, ability to fight infections, and mortality around the world. Other research highlights how changes in environmental conditions are altering our exposure to infectious diseases, reducing food production and threatening nutrition, increasing the risks of non-communicable diseases, creating mental health burdens, and even driving migration and conflict as parts of the world become uninhabitable. Nearly every dimension of human health and well-being is at risk. We cannot continue our current trajectory. The costs, in both environmental and human health terms, are too steep. We need to start by acknowledging the scale of the challenge we face. Our house is on fire. Our natural systems are starting to crumble around us. The climate system, our oceans, terrestrial ecosystems, and the biodiversity that inhabits them. And we are in peril. There's an urgency to acknowledging our predicament and taking action to get back on track. Because these problems, despite their size, can be solved. There's no reason why our children's children can't live in a world where human population has stabilized as a natural result of educating girls, creating economic opportunities for women, and providing access to family planning for couples who want it. A world where people are living mostly in cities designed to minimize our ecological impacts and maximize our health and well-being, where both food and manufactured goods are produced with much greater efficiency, where energy comes from renewable, carbon-neutral sources, where every passing decade brings more, not less, breathing room for the rest of the biosphere. If one single message emerges from the field of planetary health, it is that this moment we are in, as you stand on the threshold of your careers, is a moment of immense opportunity with everything at stake. Yes, our house is on fire, but each one of you has a bucket, and now is the time to roll up our sleeves and get to work changing the world. Almost everywhere we look, there are opportunities to make a real difference. The world needs your help, rethinking what we eat, how we produce it, and how we avoid wasting it. It needs your help thinking about how we design our cities to encourage active transport like walking and biking, and green spaces that improve mental health, reduce heat exposure, and bring community together. It needs your help advocating for clean sources of energy that reduce air pollution and don't disrupt our climate. It needs you to advocate for green chemistry and circular economies that dramatically reduce exposure to toxic chemicals and waste streams. It needs you involved in the political process, electing leaders and promoting policies that are consistent with a hopeful future. Within every dimension of global society, there are opportunities to be more efficient in our use of resources, more equitable in how resources are distributed, and more careful with the only habitable planet we know. This is the great challenge of our lifetimes. This is the fierce urgency of now. And the world is beginning to wake up to the moment we're in. Here in the United States, the Sunrise Movement is bringing together young people to demand aggressive action on climate change and support the Green New Deal. Across the world, children are walking out of schools to protest the fact that their schools are preparing them for a future that their governments are doing far too little to preserve. Our food system is experiencing a revolution with precision agriculture, robotics, and artificial intelligence, dramatically improving the efficiency with which we produce food. Supermarket chains around the world are taking on food waste with enormous gains in a very short period. In Chile's capital city, a biofactory has been installed that's turning sewage into energy, clean water, and fertilizers, and the whole system is producing more energy than it is using and providing water and fertilizers for surrounding farms. Cities like Copenhagen aspire to be carbon neutral in the next 6 years and are making huge innovations in public transport and infrastructure that supports walking and biking, green space, and smart waste management. Food systems, natural resource management, urban design, energy production, manufacturing. These are not the traditional domain of nurses and other healthcare practitioners, but arguably they're the only things that matter in the long run if we are to have a population whose health we can care for. Addressing planetary health will require breaking down silos, moving upstream in our thinking, and collaborating across disciplines to help deliver a sustainable society. There's no other option. And who better to lead the charge than nurses? When a code red is called in the hospital, it is almost always you who are the first responders, who identify the crisis, diagnose the situation, come together in teams, and ensure that each member is doing their part and that the parts are choreographed into an effective, cohesive whole. Now our planet is in code red. Fluent in science, dedicated to the care of others, and trained to work collaboratively in large teams, you could be critical agents of change for planetary health. You are also, as you've heard, our most trusted messengers. 2019 marked the 17th year in a row that nurses topped the chart for most trusted professionals in the United States. And you're the second most trusted profession globally, after, ironically, firefighters. We'll need both. Recently, the Planetary Health Alliance launched its Clinicians for Planetary Health initiative, and I invite you all to join us in that effort. Here at the University of Minnesota, under Dean Delaney's leadership and that of so many others, you have done as much to promote a cross-disciplinary program in planetary health as any university in the world. And I know you're just getting started. You should all be so proud of these trailblazing efforts. They're so important. On April 4th, in 1967, in his speech, A Time to Break the Silence, Martin Luther King observed, quote, "We are now faced with the fact that tomorrow is today. We're confronted with the fierce urgency of now. In this unfolding conundrum of life and history, there is such a thing as being too late. This is no time for apathy or complacency. This is a time for vigorous and positive action," unquote. Today's fierce urgency of now is a biosphere crumbling under our neglect and a growing awakening that our life support systems are starting to fail along with it. Let us join hands, find each other in community, and lead the way in that vigorous and positive action. Thank you.